Okay, this is Dr. Bishop once again, and I'm going to do a PowerPoint lecture on how to diagnose alcoholism and a specific criteria that I use. And so again, I'm just going to show the PowerPoint slides, and we can go from there. So a little history here. When I got out of graduate school, or shortly thereafter, I was working in a clinical position, and I actually became part of the Alcoholism Treatment Center down in Falmouth when it first opened in 1980. I had not had any formal training in diagnosing or treating alcoholism, so I was pretty fresh. I met a lady named Katie, who had extensive training and experience. She was alcoholic herself. She came from an alcoholic family, and she'd been trained to treat alcoholism. So I became actually good friends with her. And then between the information I got from her and just working in the unit, I developed the information that will be sharing with you here. So after David Letterman, I developed this what I call Bishop's Top 10, which is sort of specific questions I developed to assist in assessing probability of someone having an alcoholism or drinking problem. The 10 questions I will ask to an interviewee to assess various risk factors. The factors then are considered as a whole to assess the probability of alcoholism. And I also use Katie's criteria, which is some further questions which I'll share with you, as well as look at serious consequences from drinking. So I put all those things together and use that to come to some conclusions about whether there's really a drinking problem present. It turns out that this task is not as easy as possible, and as I mentioned, as easy as it seems, and that professionals usually don't have very good training in this task, even though they should have. So when I'm in a class setting, I usually just start by, I'll just do this with the class, and I'll say, well, you may want to do this as we go along without reading make your response before you read the part underneath the question. So if I asked you, how many beers would it take you to get drunk? And use your own definition of what, drunk is to you, and just answer that question. Now, after people answer that question, and the specific criteria is, and I did this based on norms of college students. So for males, a typical male will answer 6 to 9 beers to get drunk. And so if they have, say, double that amount, if somebody says, well, it takes me maybe about 16 to 18 beers to get drunk, I think, well, that's a pretty high tolerance, and that's suggestive of a potential problem. For females, the average female student will indicate 3 to 5 beers. If you double that, somebody's indicating a higher number, I'm thinking might have a high tolerance rate. So that's one of the first things that I look at, and that's the first question. And actually, the technical definition for an increased tolerance is needing to drink twice as much to get the same effect as you did at one point earlier when you were drinking. So sometimes I will actually ask that question as a follow-up. The second question I often ask is, was there ever a period of time when you were drinking that you were later not able to recall, what was going on? Now, I don't really use the term blackout, but that's technically, what it is. It's fairly common, and maybe about a third of college students will indicate they've had at least one episode of this or a partial episode of this. So it's not entirely non-normative. What's non-normative is if people have had more than a couple, 2 or 3. because typically you have to drink pretty much to begin to have a full or partial blackout. So if people respond in the affirmative, and I was actually doing a clinical interview, I would come and I would ask further a follow-up question. How many times has this happened? And, you know, in my mind, I'm thinking more than a couple times is suspicious. It's not statistically very common for this to occur. And then I'll ask more detailed questions like, you know, well, during those times, what did you find out later that you had been doing? And people often are doing various things. And it's a little scary because if you can't remember and you don't know what you were doing, you were awake and behaving, but you have no memory of it, often you just think, well, gee, I wonder if I embarrassed myself and what was going on. And actually, sometimes you do. So usually people seek that information from friends and other people. So sometimes they actually know what they have been doing, and sometimes, you know, if you're making passes at the boss's wife or doing very antisocial things like, you know, peeing on the sidewalk or, you know, jumping on somebody's piano with golf shoes or things like that. It's useful to know what was happening. And I also ask if they've ever had a partial blackout where they just have fragments that were forgotten. So my guess is that some of you probably have had that experience. So that's the second question that I ask. The third question I ask is, have you ever been ticketed for a DWI or a DUI, driving under the influence or driving while intoxicated? Or have you ever had a close call? So generally speaking, it's fairly common for, you know, people, especially people that are alcoholic, to have at least one DWI. If you have had more than one, the likelihood of alcoholism goes up. If you've had more than a couple, I would say the probability is very high that you have a significant drinking problem. So if somebody answers, and one of my favorite questions, if they don't answer in the affirmative, I often ask if they've had a close call, and the follow-up questions to that particular question is if they answer, yeah, actually I did have a close call, and you ask them about it. Those are very illuminating and sometimes humorous, but generally speaking, I follow up when I get positive responses to any of these questions. So I asked, you know, if you've had a DWI, you know, how many have you received? And then I'll go through and ask specifically, because if you get these, you often have to take a breathalyzer, so that you want to know what the blood alcohol level has been. I think the legal limit now is 0.8, 0.08. But I've seen people get as high as 0.2 or more, and you know, if the actual number is significant. If you're over 0.2, you're pretty wasted. And I've seen people come into the alcoholism unit with scores as 0.4. You're getting close to death if you get really high. So in any event, that's a useful question. And also, I ask again about close calls, how many times, and sometimes people have just been lucky to escape a DWI. Again, more than one suggests alcoholism. So I also ask about any other legal history, and in particular public intoxication, which is known as a PI. And again, if they answer in the affirmative, I ask how many times and what the circumstances. And in particular, some people that are alcoholic or have drinking problems. Some people that are alcoholic have drinking problems will indicate that they get sort of aggressive and antisocial and, you know, pick fights and, you know, sort of the little guy taking on the whole bar. And some people just have a change of personality when they drink, and when they do that, then they get in fights in a bar, or they do other things that are antisocial or call attention to their situation, which ordinarily it wouldn't occur. So anyway, I get as many details as I can, and okay. So, and I ask also about any other legal history, because the alcoholics have often will have legal problems. So, coming back to tolerance. Okay, I'm going to stop this here. Okay, I was in the middle of this, and I got a phone call, and so I answered that. So, picking back up with the top 10 here. And coming back to tolerance, I often ask, what's the most beer you've ever drank on one occasion, say in a few hours? This is a really interesting question, particularly if you got a macho male. And males, by the way, are outnumber females in this category of disorder. I don't know if it's still like 4 or 5 to 1, but it's pretty significant. But if you get a macho male, they'll say, oh yeah, I had a case, I drank 24 in 3 hours or something else. And without recognizing it, they're telling you they have an extremely high tolerance, actually. So you get anything above 12 for females and 15 for males. Again, you've got signs of high tolerance, which is a classic kind of symptom. I also asked them, how well do you hold your liquor? So often people who develop tolerance will develop the appearance of looking more in control, and their behavior is not as affected as, say, somebody with less tolerance who looks more drunk. So I asked the question, how well do you hold your liquor? And somebody says, well, I can really hold my liquor really well. I can drink a whole bunch, and nobody knows I'm drunk or, high. So that's another question. Another question is, I always ask if there's any family history of alcoholism or problem drinking. Parents, grandparents, siblings. It's very clear that alcoholism has a genetic component, particularly for males. And sometimes if you're the son or daughter of alcoholic family, parents, and you have high tolerance in particular, I indicate that there's maybe a high risk for developing problems yourself. What seems to be inherited is high tolerance. An eighth question that I often ask is, does anyone in your family or any of your friends think that you have a drinking problem? This is a particularly interesting and useful question. I have found in my own experience that if you have a drinking problem, somebody in your immediate social group will notice, and they'll say something about it, almost always. And actually, there's problems within the family is often a first sign of drinking problems, even before some of the other, like legal problems and so forth. So this is a really useful question. The other thing I sometimes ask is, well, if I haven't given them, I take note of what their max score is, and again, I've covered this elsewhere, but if they're in the high range, I'm a little more suspicious. Then the last one, which is a really interesting question, I ask, do you smoke cigarettes? And this one's a little tricky, because if they answer no, and it's sort of, I'm not really telling whether they're having a problem or not. They answer no, it suggests to me that they may not be alcoholic, for the simple reason that probably 95% of alcoholics will smoke cigarettes. It's amazing. That correlation is extremely high, And if you've ever been to an AA meeting or in treatment setting for alcoholics, one thing you know is they drink a lot of coffee and a lot of, coffee and smoke a lot of cigarettes. The air is pretty thick with smoke. So that's also useful to sort of separate people out that may not be alcoholic. It's not foolproof, but it's a good question. So in addition to this, I use some criteria that my good friend Katie uses, and she asked if is there any evidence of loss of control over use of the substance. And by the way, a lot of these criteria will be very useful for substance abuse and use, overuse, and addiction of any substance. But basically, this is one of the criteria that's a sort of inbuilt in the definition of alcoholism from the World Health Organization. So the loss of control is a key factor, and people can go a long time and drink moderately without any consequence and with pretty much control over their use. But at some point they may lose control. So more specifically, you want to know, is there an inability to stop after starting to use or drink? And whether there's drinking to point of serious consequences, they get in trouble, they get in a fight with their spouse, they get in trouble with the law, they get a DUI, any of a number of things. They have problems on the job and so forth. And whether they have blackouts, whether they're putting drinking ahead of everything else, there's a loss of control can take many forms, and Katie outlined some of these. She had a specific test actually that she used, and if somebody would come in and so somebody probably kind of urged them to, or kind of forced them to come talk to Katie, she would say, well, I'll make you a deal. You either drink not at all for 3 months, or for a full month, no alcohol, or you have no more than 2 in any one day. And they would almost always choose, 2 in one day. You couldn't save them up. You couldn't, for example, go 5 days and then have 10 on Saturday. So she would offer this test, and if they failed the test, they would agree to go into treatment. Now, obviously, you have to have a spouse or somebody around to sort of monitor use. But she found that was a pretty good kind of test and a way of sometimes getting people into treatment. She would find that people would go maybe a week, 2 weeks, 3 weeks, and then all of a sudden they just have a bender. So, but the basic issue is loss of control over use. She used specifically tolerance again, and she defined it in a way I have already covered, and also looking like you're unaffected by large amounts. She also used the criteria of blackouts, and again, more than a couple are suspicious. She specifically talked about personality change. Does the person become violent or aggressive when drinking? If someone's close to someone that has a problem, they can tell you right away that the person's the nicest person until they start drinking, and then they get very, it's like Jekyll and Hyde. They change into a different person. And in particular, if they have any fighting or PIs and things like that when they're drinking. Her 5th criteria, which I didn't really cover, which is important, is there any evidence of denial? Denial is a classic symptom of alcoholism. So when somebody makes statements like they say are oblivious to the effects of drinking on their friends and family, they'll start saying things like, I can take it or leave it, I only drink in the morning, I only drink beer. When you hear stuff like that, it probably, normal drinkers don't say things like that, and it's like a red flag typically. So this is a denial type statement. It's kind of a defensive response. Typically, people who are alcoholic are pretty much oblivious to their inability to control use, to the effects that the drinking have on their own life, their relationships, their work, their schooling, the whole 9 yards. So sensitivity to defensiveness. Okay, so given all of that, how do you actually go about kind of compiling all of the evidence? Usually, if you find somebody that's truly alcoholic, they will give you evidence, if you ask the right questions, of many of the preceding criteria that I have gone through. Although, I will say there's no absolute number or absolute pattern. It's really important to recognize that each alcoholic person shows or may show a unique pattern, which then, there's no standard. So it's hard to make a diagnosis, and it makes it confusing, particularly for, people that are not trained. And that goes for both family and professionals. So, for example, some alcoholics don't have changes in personality, or they don't have blackouts, or they don't drink in the morning, or they don't have DWIs. But an alcoholic will say, well, I don't have this, I don't have that, and so forth. And if you don't know where else to ask or to look, you may miss the point. If the person's physiologically dependent, most will show signs of tolerance or reverse tolerance or symptoms of withdrawal. So reverse tolerance is needing less alcohol to be drunk and is a sign of late-stage alcoholism. Many alcoholics, however, are not actually physiologically dependent, so this isn't definitive either. You need to look at the overall picture. It's alcoholism is defined as drinking that causes serious life problems. That's one diagnosis. It's not really precise, but on the other hand, is it causing a serious problem? Another definition is a lack of control over drinking that results in serious life consequences. Same basic idea, but it adds the issue of lack of control. Now, assessment of serious life consequences is therefore important if you're going to sort of see if it meets this definition. And here in the next section, I'll talk about the ways in which alcohol problems typically affect the person and their family. They may have just a few of these, or they may have all of these. And if you know somebody and you go through and you ask this question, it may become pretty evident. So, one serious life consequence is it affects the family members and the family relationships. And the average alcoholic in the unit I worked in had been married two or three times, typically 3, and if they had come into the unit recently, their current relationship was typically in the process of divorce or splitting up. The children that live in an alcoholic family growing up, and if any of you have ever had this, are in this category, you know that you can be seriously affected. Alcoholic families are unpredictable, and it just makes it difficult. It's hard to have people over. There's no predictability. Family violence is common. It's interesting to know that 50 to 90% of women in shelters for battered women have alcoholic husbands or drug-addicted husbands. So the correlation here between family violence and addiction is very high. You see, in some cases, effects on work, missing work because of being hungover, decreased motivation to work, decreased productivity, quality of your work goes downhill, loss of a job because of drinking. I had one patient I remember very well, and he said he got by in his work, but he lost his motivation completely. So you can see impact on work. Legal problems, as I mentioned before, very frequently you'll have some sort of legal issue going on, as you can see here in number 3. Serious accidents. It's probably not as well known as you would think, but nearly 50% of all fatal accidents will involve drugs and or alcohol. And not as well known is probably 3/4 of all emergency room incidents involve drugs or alcohol. I've talked to emergency room personnel and people that drive the emergency vehicles, and they just say, yeah, absolutely. And you just see this all the time. So that's another thing that you'll find. Health problems, very common. And, you can get liver problems. Malnutrition is common in an inpatient setting. We had our typical patient would gain 10 to 12 pounds in 3 or 4 weeks because alcohol doesn't have any nutrients, and it's got a lot of calories, but you get a lot of malnutrition. In some cases, you'll get something called DTs, delirium tremens. Some of you may know what this is. It's sort of a withdrawal syndrome, and it's a serious condition. You can become, psychotic if you have a quick withdrawal of alcohol, when somebody's been using very heavily. They'll develop hallucinations and delusions. They'll see bugs and spiders crawling on a wall or on their arm, and they'll have what's called the shakes. So they'll be shaking. And this can be actually serious enough so the person can actually die from it occasionally. Now, you don't see that in all alcoholics, but you will see it in some. You can have exacerbation of existing problems like lung or cardiac disease. The average alcoholic will probably die 15 years, if untreated, 15 years before their life expectancy. You'll see, in some cases, deterioration of mental functioning. There's something called amnestic disorder or Korsakoff syndrome, where people will lose the ability for short-term memory, and they'll make stuff up. So with Korsakoff syndrome, you ask somebody, well, what's my name? And you introduce yourself. 5 minutes later, what's my name? They'll say John. And 3 minutes later, you'll ask the same question. They'll say Bob, and you ask them what they had for breakfast, and they'll make something up. They have lost literally complete short-term memory. So it does temporarily, and sometimes, if you drink long enough, have a permanent effect on your long-term mental functioning and memory in particular. You invariably see mental health problems develop. This video I'm going to show you of Tim showed that he had serious mental health problems. You get lowered self-esteem and guilt over the effects of drinking on himself and others, loss of motivation, depression, very common, suicide attempts, very common. As mentioned earlier, you get all kinds of marital, legal, and other problems. With all those problems, with divorce and lawyers for legal problems and health problems and doctor's bills, all this stuff adds up to a lot of money. So usually people with alcoholism have financial problems. One patient I met in the unit was scary enough, was a truck driver. He drove semis across the country, and he told me in one instance he took off from Columbus, Ohio, and he drove clear to San Francisco, and he can't remember a bit of it. He was in a blackout the whole time. That same patient told me, and this was before they cracked down on DUIs and so forth, but he had spent $36,000 to get rid of 12 DUIs on his record, clear his record. So he'd spent $36,000. It's a lot of money. Alcohol and drugs themselves are expensive. So if you drink or using a lot, cigarettes and all this stuff, that's expensive. The average treatment, inpatient treatment at the time I was working was $10,000. for 3 weeks, and now that would be cheap. If you do that a few times, your money's going to start running short. Okay, so that's that. Now, I wanted just briefly to mention that in DSM-5 they combined these criteria, but in DSM-4 they had the specific criteria. They have divided into substance abuse, where you didn't have physiological addiction, but you had you're abusing to the point that it's having some serious behavioral and other consequences. So they had that abuse category, which was theoretically a little less serious than dependence. So they had these criteria here, and I'm going to let you read these on your own. You can stop the video and look at it. So this was the abuse criteria for DSM-4, and then the substance dependence criteria, which showed tolerance and withdrawal, which was theoretically more serious, included the following criteria here. Now, I've also, in a separate item on a Blackboard in this section, posted the whole DSM-5 section on substance use and related disorders. You might want to look through that. I'm not going to test you on it, but it does, several of you had mentioned it was really useful to get the details of some of the DSM criteria. And at the end of that, it gives the full current DSM criteria for substance use and addiction-related disorders. Okay, I'm going to stop here then.